So in other words, what you're saying, and I guess we've heard it 2 or 3 times during the program, is that even to call this Lyme disease is in some sense at this point a misnomer.
Correct.
That basically it's a set of symptoms and a set of bugs that come through a tick bite.
Absolutely.
And it's no longer the one spirochete isolated so many years ago as the spirochete that is carrying Lyme disease.
Correct. And I think it's one way of bringing these guidelines committee together, of trying to understand why one set of researchers would say this about research done just on Lyme, and what we're seeing in clinical practice is completely different than what's in the literature. You can't find medical literature that describes these people with multiple tick-borne diseases, with hormonal problems and sleep disorders and all the other issues that they present with in a medical office.
Now, let me ask you, you've piqued my interest. If someone shows up with a set of symptoms, could they possibly have not gotten the particular Lyme disease spirochete, but just have gotten some of those other things that we know ticks are carrying today?
Yes, absolutely.
And so they would have a set of symptoms, and those other bugs are even less recognized than the spirochete that carries Lyme?
Well, the doctors just don't think about necessarily when someone has joint pain and fatigue and headaches and memory problems, doctors may not think Bartonella cat scratch fever.
Right. They don't think infectious disease. They think something else, as we said, like MS, ALS, fibromyalgia, those sorts of things?
Correct. And unfortunately, the immune system does get stimulated by this bug, so you can get false positive tests for lupus or rheumatoid arthritis, where the rheumatoid factors are positives or the anti-nuclear antibodies are
In other words, what you're saying is very often we're not testing for the presence of the negative, we're testing for the presence of the antibodies to the negative, and those antibodies will show up to treat its host, whether the stimulus was what the doctor's looking for or not.
Correct.
Oh, my God. This is tough stuff, isn't it?
Yeah, it's very difficult.
Yes. And there's still a long ways to go. And
this is Andy again, the producer-director of Under Our Skin, the film about Lyme disease. And when I say about Lyme disease, it's about all the issues we're talking about during this program. Opens Friday in Los Angeles.
Right. And, what we found in the making of this film, and this took us over 4 years, is it's fascinating and it's frightening, what we've just been talking about, which is about the bug itself or the bugs themselves. But this is also a question of medicine and medical research, which is if it really is a question, an illness that is caused by multiple pathogens and causes multiple symptoms in multiple systems of the body.
Right. In other words, by the way, let me just emphasize that point you just made. Sometimes people are willing to look at more than one symptom, but few doctors are willing to look at more than one system. By that you mean the neurological system, the brain system, the respiratory system, etc., right?
Correct.
Yeah.
And you have to look at how we're approaching medicine. We're looking for something. We're looking for a test. We're looking for medicine that is going to attack one of those things. In order to show efficacy, we really have to narrow the disease definition, and that's what's happened. Basically, is our research has shown that many of the people on the guidelines writing committee have significant conflicts of interest, meaning they stand to profit, they or their universities stand to profit from their recommendations, and it is much easier to show efficacy, as I mentioned, if you are able to easily define the disease symptoms and the outcome. Now, if you really admit to what this illness is,
that is the complexity of it.
The complexity, then it's going to be very difficult to make your product work. And in the end, that's what we've got going here.
Now, right now and I'm going to go to Dr. Lorraine Johnson on this, but is the issue that, what's a surprise that some health issue in America is driven by money and profit? But is it that because I haven't heard that is it that the folks who have the antibiotics are stand to gain, or is it the folks who are trying to develop something like a vaccine stand to gain? Dr. Lorraine Johnson, attorney, and I'm sorry.
Yeah, thank you. I mean, the thing that happened with Lyme disease that was very unfortunate is there was not a lot of money to be made in the drugs that treat Lyme disease. The real money to be made in Lyme disease was in vaccines. And so the push to define this disease narrowly came in as the vaccines were being developed and as the vaccines were being manufactured, and the need to have a narrow definition for research purposes became paramount. And that definition works well for vaccine purposes, but it does not work well for patients. Patients, in terms of diagnosis, need a much broader definition that will recognize the illness that's going on with them and that will allow them to get treatment.
Is there a vaccine, or is that vaccine still in development?
There was a vaccine that was pulled from the market after substantial adverse effects, and there are other vaccines that are in development.
Okay. What I would like you to talk about now, Lorraine Johnson, is the legal challenge that's going on because, as we say, right now we're talking about Lyme disease. We're talking about a problem in medicine, but this problem of definition, the power of guidelines to restrict treatment, to restrict insurance reimbursement and so on, we're going to see this grow, I think, over time. What is the legal case that has been brought, and what are the possibilities that shows us?
Well, what happened here was when the IDSA came out with its guidelines in 2006, patient groups went to the Attorney General in Connecticut and told him that they were being denied care, that they couldn't find a doctor to treat them. Most patients have reported that they've had to go out of state to find a doctor to get properly diagnosed.
And let me say one other thing. In the film, it features the fact that some of the doctors who have gone out of their way to treat this have been prosecuted by their medical boards and so on, and the doctor who helped you so much, Mandy, has actually lost his license, I believe, in North Carolina for treating it in a way that actually was successful.
Well, that's right, and that's what's important here is, you would think that if you have a difference of opinion, one group thinks this, another group thinks that, you've got two medical societies, it's even Steven, but it's not even Steven when you have a medical society that has a type of power and monopoly power that the IDSA has, and that's what you have here. Their guidelines are taken as the truth and as science and used against their competitors to essentially drive them out of business. This is why we've become so concerned about the guideline climate in the United States, particularly when you have conflicts of interest on guideline panels.
Explain some of the conflicts of interest of the IDSA, which is the Infectious Disease Association, who has set these guidelines, of the folks who were on the panel that set those guidelines.
Yes, the people who were on the panel, the panel consisted of a number of individuals, but key members of the panel had been involved in consulting on the vaccine trials or had been involved with diagnostic drug tests or that had patents related to Lyme disease or had consulted with insurance companies. And, the fact that you had those many people, the number of people that were on that panel, that helps drive opinion. It helps sway things. That's why the pharmaceutical industry likes to have what they call key opinion leaders. They find people who can help influence their peers, and they work with those people to start developing products and so forth. And a number of the people who were involved on this guideline panel were considered to be key opinion leaders. They were people who had worked on the vaccines and helped shepherd those through. So that's a real problem when you don't have a countervailing balance on these.
Let me ask, we're getting very close to having to wrap up. What is the status of this legal case that the patients and the Attorney General have taken in the state of Connecticut? And is it basically a claim of antitrust based on conflicts of interest against the folks who set that guideline or the whole society?
Yeah, essentially what happened is the case was based on antitrust law, which does not allow a large monopoly. If they're going to set a standard that takes on the force of law, as the IDSA guidelines have, they have to play fair. And playing fair means that you have to include and consider opposing points of view. You have to look at other evidence. You have to make sure that your panel is free of conflicts of interest because you're setting essentially standards and guidelines that take on the force of law and can take away other people's personal liberties and rights.